AUA Roundtable Healing the Healer is bringing to you a discussion tonight with Dr. Shah, Dr. Matthew, Dr. Rao, and Dr. Nazareth. So, Dr. Shah, let me ask you, across the waters, what are you seeing in the hospitals?
It is quite quite a difficult scenario that we as health professionals, no matter what part of health we are working in whichever roles, it has been very, very difficult. The first few months in my practice, I saw people, doctors, nurses, other health professionals, and allied professionals who had a lot of motivation, wanted to help people. There was a lot of goodwill and altruism. But as the months went by, fear and panic in particular, especially to the pathological level, we started seeing more in our clinics. It was as if the amygdala was just firing. And it was being very, very difficult for them. As we have progressed further, I've started seeing in my own practice many doctors and nurses who present to me. Now, of course, the burnout, which my colleague has already spoken about, whether it's mental exhaustion, emotional exhaustion, disengagement completely from their roles or the purpose that they're having. They are detached, and in particular, they're also getting physically quite exhausted as well. So the burnout symptoms, definitely. But in the last 3.5 months or 4 months, now I'm seeing my colleagues who are coming in with moderate to severe levels of depression who do not think there is any value in staying alive or in helping people. They can't take a break, and we are seeing more people into that levels, and including some forms of psychosis related to stress. Some of them have gone into maladaptive behaviors like drugs, alcohol, or things that we would not expect at the moment. Also in the UK, and I think it's across the world, as health professionals, we did not have a break. We come into this profession for the purpose of helping people to prevent them from becoming more unwell, to save lives, or at least if we can't save lives, to make it more dignified paths. We are not able to follow those values because what we are seeing at the moment with us is it's unpredictable. We are not able to save lives as we would expect. I became a doctor to save lives or to help, but I'm doing maybe sometimes the opposite, or not helping them. So all those things will lead to burnout, anxiety, depression, and many other aspects. So it is difficult at the moment for all healthcare professionals.
It's definitely a very scary scenario for the whole world. I don't think it's particular to US or the UK. I think it's all over the world. Let me ask Tara, what are you seeing? Are there any radical shifts and changes that you're seeing among your patients and the families? A mindset difference. Are you seeing anything different?
100%. I'm have the luckiness, I suppose, to say that I'm the only resident who of this panel who was doing their residency during the pandemic. So as a psychiatry resident, I was running codes. I was naming time of death. Those are not things that we're used to doing after our medical training. And so it took a great toll on those of different specialties, on those who were just helping because everything was going insane. Patients were so scared to come to the hospital because they were scared of getting COVID. But then their medical and, for us, psychiatric problems became so severe because they did not come when they would have come otherwise. Usually they would come when they would see a problem starting to arise before things got to a dangerous level. And on the medical side and on the psychiatric side, we were seeing patients come in when they were so severe that they were ending up spending longer in the hospital. They were scared to come at all. And really, people were dying because they were scared to come to the hospital. They thought only COVID patients were coming. So regular medical problems like heart failure, like diabetes and ketoacidosis, like psychosis were not being taken care of adequately because all of us had all of our attention on COVID.
Dr. Rao?
So I agree with Dr. Nazareth. Being a family medicine physician and being an outpatient family medicine physician for nearly 10 years, we were asked to be deployed to our local hospitals, roles that we were not used to or comfortable with. I would say that I saw a spectrum of responses from my patients as well as their families. I agree. I think we definitely acknowledge and saw all the fear that was being produced. We saw a lot of changes in their response in terms of anger, gratefulness, indifference. So it was a wide variety of responses. I saw also that the need for primary care increased dramatically because our urgent cares, our emergency rooms were completely inundated. So patients didn't know where to go. They didn't know where to seek help and guidance, just as Dr. Nazareth pointed out very well. I would say that there is still quite a bit of fear to come, but again, I am grateful that many of our patients and their family members have shown that they are thankful and grateful for us to be where we are during this pandemic.
It's a very difficult balance for a non-medical person to make a decision about, do I go to the hospital, or do I call my primary care, or do I just stay at home and self-medicate and self-treat? What do I do? Is there a marked difference in the hospital system dealing with the staff shortages? And what changes do you think they're implementing? Dr. Matthew?
Yeah, I think, especially in critical care, in the cath lab, and in places where, the nurses burned out, I think we're seeing marked shortages in staff. It's been a little bit of a problem. A lot of it is being replaced by, traveling nurses, traveling companies that are providing short-term staff, and that's caused a huge problem. Then you have staff that you're not familiar with, that are not familiar with the system. Same thing with physicians. Physicians are being replaced by these companies as well, and it puts a stress on the system that exists because things are not working the way they normally do. I think hospitals are working as hard as they can to improve mental well-being for all of their employees. I think there's been a significant amount of attention here at Temple in Philadelphia for that. I think they've done multiple things, multiple events, in addition to just counseling or therapy, to try to promote more staff morale. And I think that has to be an ongoing process because I don't think we're done yet, and I don't think this is going to be a short-term thing.
Sure. Dr. Shah, would you say that in the UK as well, with the staff shortages, the hospitals are making changes or trying to make changes?
No, indeed. I think in the UK, most of the healthcare is provided by National Health Service, which is free at the point of care and others. And we are seeing a large number of very, very remarkable numbers of staff shortages, either due to people becoming sick and going in isolation, or burning out, or having other aspects. Just like mentioned just now about traveling companies and others, we have what we call as agency staff, and who may not know the patients or the hospital as much. That does put pressure on. The hospitals are really, really working hard, but we have to understand as well that the health administrators or management or leaders are also going through this and are humans. They're also struggling to manage the aspects. So it is a very, very dire situation. And probably what this pandemic has done is expose the cracks that we have within the health system across the globe. And we know that it does need to change once we are out of this pandemic. We have to become a lot more resilient because for us, staff are the main. That's the main force that we have. No matter how much of technology or others we have to really empower staff and make sure that we have adequate. But the pressure is definitely ongoing, and I expect that for at least another several months, if not for a year or two.
The American University of Antigua Roundtable Healing the Healer will take a break and return shortly.